American Journal of Preventive Medicine presents mothers' adverse childhood experiences and their young children's development.
A study from September of 2017.
Introduction. This study examined how mothers' adverse child experiences related to their children's development risk and assessed how the association is mediated through mothers' depressive symptoms and poor health.
This type of design is considered to be a mixture of quantitative descriptive research and correlational research design. The terms find, ACE, adverse childhood experiences, PEDs, parents' evaluations of developmental status.
ACE adverse childhood experiences includes exposure to physical and emotional neglect, household stressors, witnessing a mother being abused, having an incarcerated parent, traumatic events linked to lifelong negative adult physical and mental health outcomes. Examples are attempted suicide, chronic diseases, adult depression.
Introduction. Outcomes of ACE occur through multiple routes, including epigenetic pathways whereby traumatic events can modify gene expression in the prefrontal cortex, cause inflammation, and trigger allostatic responses to stress that alter the nervous, endocrine, and immune systems in ways that may disrupt parenting and economic success.
Overall, the relationship between mothers' adverse childhood experiences and their children's developmental risks demands further investigation.
The objective of this study is to examine associations between mothers' reports of ACEs and their children's developmental risk.
Two hypotheses. Number one, a higher number of mothers' ACEs is associated with increased odds of children's developmental risk. Two, the association between mothers' ACEs and children's developmental risk is mediated by mothers' reported depressive symptoms and poor health.
Methods. Mothers of children aged between 4 months and 4 years were recruited from the Emergency Department of Children's Hospital, March 2012 and June 2015, and interviewed about ACEs, mothers' depressive symptoms and health status, and children's developmental risk. Between August and November 2016, a Cochrane Armitage test assessed trend of PEDs and ACEs. Multinomial regression models examined differences in PEDs by ACEs severity, mediation by mothers' depressive symptoms, and self-rated health.
Of those interviewed, respondents who were excluded are children less than 4 months, non-biological mothers, foreign-born mothers, non-respondent AC surveyed. Those included were children age older than 4 months old, biological mothers, U.S. born mothers, participants. Final sample participants were 1,293 from Philadelphia Children's Hospital.
Measures surveys. The survey contained questions about caregivers, demographic characteristics, and household public assistance participation. Caregiver and child health were rated by the caregiver with standard questions from National Health and Nutrition Examination Survey. Household food security status was evaluated and categorized using the 18-question Household Food Security Survey module.
Depressive symptoms were assessed using a 3-item validated screen tool that asks about feeling depressed, sad, or blue in the last week, weeks in the previous years, and years in one's lifetime. Depressive symptoms were indicated by an affirmative response to at least 2 questions.
Measures children's development risk. Children's developmental risk was assessed with PEDs, a validated 10-question parent-reported screening instrument of children's development. The sample restricted to children aged greater than 4 months to 4 years of age. Parents reported any concerns, no, yes, or little in response to questions about the child's development in receptive language skills, fine and gross motor skills, behavior, social emotional behavior, self help, and school.
Children with 2 or more concerns are considered at high risk for developmental disabilities verified by clinical assessment. More than 50% of children identified through this mechanism may have undetected disabilities, and many of the rest may score below average in school or demonstrate psychosocial behavioral actions or both. Children with 1 or more significant concerns require additional screening, monitoring, and intervention and are considered at moderate risk for development disabilities. Parents of preschoolers who report for 1 or more parental concerns of accurately predicting their child's risk for physical and social emotional problems as assessed by a clinical assessment. Children with 1 or more parental concerns in the behavior and social skills domain are at 8.5-fold increased risk of being diagnosed with mental health problems by external clinical assessment, and children with 2 or more concerns are 20 times as likely to be diagnosed with a disability by clinical assessment than are children with no parental concerns.
Measures ACE scale. Mothers' childhood experiences were determined by their responses to the Adverse Childhood Experiences Scale. ACE scale is a retrospective 10-question survey that inquires about experiences before age 18 years: physical, emotional, sexual abuse, emotional, physical neglect, parental separation, divorce, exposure to domestic violence, abuse, mental health conditions, incarceration of household member.
Accumulation score was calculated for each participant based on the number of affirmative responses, each corresponding to 1 point. The score was categorized into 0, 1, 2, 3, 4, or more ACEs. Results. Of 1,293 mothers, 56.7% reported 1 or more ACEs. Mothers also reported developmental risk. 120 reported 1 concern, and 144 reported 2 or more concerns on the PEDS test. Mothers who reported household substance abuse, mental illness, or incarcerated household members during childhood were more likely to report at least 1 child developmental concern on the PEDS versus none. Mothers' depressive symptoms and self-rated health were potential mediators.
Discussion. These findings build on research showing that childhood adversities increase risk for adult chronic disease, poor behavioral health, and economic insecurity by demonstrating that mothers' exposure to ACEs increases likelihood of their report of their children's developmental risk. These findings are also consistent with recent evidence that ACEs are associated with perinatal depression and social emotional problems for infants.
Results show that mothers who experience parental incarceration substance abuse, or household mental illness were more likely to have a child with at least one developmental risk factor compared with mothers with zero ACEs. This analyst found that both individual ACE and the cumulative number of ACEs are associated with developmental risk in the next generation.
Recommendations. Although additional research is required to fully understand the intergenerational effects of ACEs, there may be some preliminary steps that the clinical and public health community can take to help minimize ACEs and provide comprehensive care to families that needs help to ameliorate adversity, depression, and child developmental risk.
Early childhood education, such as early Head Start and early intervention programs, housing housing subsidies, two-generation programs, nutrition assistance, access to behavioral health care have been shown to promote health and wellness among families with young children. Programs that strengthen families and reduce precursors to substance abuse and depression may reduce ACEs and their negative consequences. With a focus on preventing adversities among Americans' children, health professionals may be able to promote the well being of current and future generations.
Limitations. In this design, parental depressive and physical health symptoms may recede, follow, or concur with reports of the children's developmental risk. Because mothers report on all outcomes, there is potential bias through shared method variance. Despite these potential bias, this study opens new research avenues, including studies that utilize independent assessments of children's development.
In conclusion, ACEs are serious health problems that may cross two generations. Today, children's experiences have lifelong consequences that may affect the next generation. ACEs are significantly associated with their children's developmental risk. If replicated, findings suggest that addressing intergenerational trauma through focus on childhood adversities among children